This series of short recordings will share the results from the 2019 Advocacy Ecosystem Survey that we at Innovation Network conducted in partnership with the Colorado Health Foundation. Innovation Network is the learning partner for the Foundation's Amplifying Advocacy initiative. This video is a quick introduction to the background and purpose of this work, as well as a brief overview of the types of organizations that completed the survey. In the following recordings, we will share findings and pose some questions to start thinking about what these data mean for your organization and the larger advocacy ecosystem in Colorado. So if you want to skip the background, you can move on to the other videos. The Colorado Health Foundation is working to support an equitable, representative, and inclusive advocacy ecosystem to advance health equity in Colorado. In 2020, the need to shift power within our systems and society is more visible than ever, and the need to follow the lead of impacted communities is clear. To this end, the Foundation is working to build out an information base about the advocacy ecosystem in Colorado, to inform their work as well as to share these data with the field, with the goal of ultimately fostering discussion and shared understanding about this collective landscape from different perspectives in order to shift resources and ultimately power within the ecosystem to center the voices of organizations led by and directly working with most impacted communities. Innovation Network conducted a survey of advocacy organizations throughout Colorado in the fall of 2019, beginning with contacts closer to the Foundation and then sharing with additional contacts based on their reported key partners. The survey ultimately received 125 responses. While a broad range of advocates were reached, the ecosystem, as reflected in these data, necessarily is only a portion of the larger ecosystem of advocates throughout Colorado. So this is a starting point and a look at a point in time to build upon and learn more. The survey focused on 4 key things: who advocates seek to serve or represent, who is represented and informs decisions within organizations, how advocates do their work, and what partnerships look like within the network. To give a sense of who responded, a little less than half of respondents say that their primary work is advocacy, including community organizing and movement building, while almost as many prioritize service delivery. 70% of organizations have budgets ranging from $100,000 to around $2 million, with fewer organizations above and below this range. And most organizations focus their work across Colorado statewide. Of those that don't, the majority focus on just 10 of the state's 64 counties, which are shown in blue on this map. As you can see, advocates are more concentrated in Denver and 3 counties around it. Counties in gray have less of an advocacy presence, as seen in the data, with 4 or fewer organizations specifically working in these counties. And 23% of respondents said that they work in counties that are shown in gray on this map, which throughout the rest of the presentation we will refer to as sparse counties, just for our purposes here, though we know a lot of organizations may be working in these counties that were not revealed in the survey. When asked to specify their priority issue areas over the last 3 years, the majority of respondents selected healthcare, followed by economic opportunity and mental health, and then safe and affordable housing. In the following videos, we will talk through the findings about who organizations serve, who is represented within them, how they do their work, and what partnerships look like within the ecosystem. So tune in to learn more.